Hello everyone, and welcome to this explainer. I am so thrilled to have you here today. If you're a pharmacy student or honestly just someone who is endlessly curious about how medicines actually work in the real world, you are totally in the right place. Today, we're stepping into the fascinating world of pharmaceutics. We're going to decode exactly how the medicines we take are designed, formulated, and delivered. So grab your notebooks, get focused, because we're going to make this complex topic incredibly simple and fun. Ready? Let's get right into it.
To kick things off, I want you to think about a really simple question. Socho agar aapko kachi dawai khani pade. Yuck, right? Imagine having to scoop up a spoon of raw, bitter chemical powder every single time you got a fever. We don't do that. It's kind of like making chai. You don't just eat raw tea leaves, chew on some ginger, and swallow a handful of sugar, do you? No, you boil it, you process it, and you create a perfectly blended liquid that's actually pleasant to drink. In that exact same way, you can't just eat a raw, active pharmaceutical ingredient, or API. It absolutely has to be processed into a usable, effective format.
The basic funda ye hai. Today we are going to clear up these 6 things. Section 1. What is a dosage form? Section 2. The need for dosage forms. Section 3. Classifying dosage forms. Section 4. Solid dosage forms. Section 5. Liquid dosage forms. And wrapping up with Section 6. Semi-solid dosage forms. It's a highly structured roadmap, so you'll know exactly where we are, every step of the way.
All right, let's jump straight in. Section 1. What is a dosage form? The perfect blend.
Bridging the gap from our chai analogy to actual pharmaceutical science, we really need to understand what makes up the perfect blend of a medicine. Basically, any medicine breaks down into 2 distinct halves. On one side, we have the API, the active pharmaceutical ingredient. That's the actual raw drug. Like if you take a headache pill, the API is the chemical that's literally stopping your headache. But on the other side, we have the additives, which we formally call excipients. These are the completely non-drug components. So why do we need them? Well, they give the medication its shape, they increase its stability, and they increase palatability, which just means making it taste better and giving it a bit of elegance. Think of it like this. The API is the engine, and the excipients are the chassis and the steering wheel that actually make the car drivable.
And when you combine that active drug component with those carefully selected non-drug excipients, boom, you get a dosage form. These are essentially pharmaceutical products marketed for use. They are perfectly designed to be safe, effective, and stable delivery systems for getting medication into the human body. That formula, API plus additives, equals our final ready-to-use dosage form.
Moving right along to Section 2. The need for dosage forms. Why go through all the trouble?
दवाई को प्रोसेस करने की इतनी मेहनत क्यों? Why do scientists spend years designing these specific formats instead of just handing out the raw chemicals? Well, transforming a drug into a dosage form solves a whole bunch of problems. First off, किसको bitter दवाई पसंद है? Nobody. Formulating a dosage form completely masks those incredibly bitter, salty tastes and bad odors of raw drugs. Secondly, it protects the drug. Some drugs oxidize easily in the air, or they just get destroyed by the harsh, acidic gastric juices in our stomachs. A proper dosage form acts like a protective shield. Third, it guarantees a safe, convenient delivery of a very accurate dosage, so you don't accidentally underdose or overdose. And finally, specific forms allow for specialized actions. Think sustained release over 12 hours, or optimal targeted action, like using an aerosol inhaler to deliver drugs straight to the lungs.
Okay, Section 3. Classifying dosage forms. The big picture.
Now that we get the why, let's look at the how. We need to organize this massive world of medicines based on their physical states. If you're a pharmacy student, consider this classification system your absolute best friend. It categorizes dosage forms into 4 main branches: solid, semi-solid, liquid, and gas. Under solid, you've got powders, tablets, capsules. Semi-solid, think ointments, cream, suppositories. Under liquid, there are solutions, syrups, suspensions, and injections. And finally, gas, which covers aerosols and inhalants. We're going to focus on the first 3 branches today to really nail down how physical state changes absolutely everything about how a drug is used.
Let's dive into Section 4, Solid Dosage Forms. The classic pill.
Starting with the most common branch, when you think of medicine, you probably visualize a classic pill, right? Like a daily paracetamol tablet. Solid dosage forms are incredibly popular for some very strong scientific and practical reasons. First, they are highly stable compared to liquids or semi-solids. Because they lack moisture, they just don't degrade easily. Second, bag mein tablet ka patta carry karna kitna aasan hai na? They're extremely easy to handle, package, and transport. Third, because they're manufactured as distinct, separate units, like 1 tablet or 1 capsule, they deliver the most accurate dosage possible. And since they're dry, they generally don't require any additional chemical preservation against microbes. They really are the ultimate convenient medicine.
Tablets to ठीक हैं, but what about liquids, like a Benadryl syrup? While stable, convenient, solid pills are great, sometimes we actually need the drug to be already dissolved and ready to be absorbed rapidly.
Which brings us to Section 5, liquid dosage forms. Fast but fragile. Liquids, which include simple mixtures, syrups, and suspensions, are amazing for fast action. Plus, they're great for patients who just can't swallow pills. But they are inherently fragile, and there are some significant demerits we need to talk about. Unlike a perfectly measured tablet, with a liquid, the patient has to measure the dose themselves, usually with a spoon or a measuring cap. That leaves room for human error. Also, because they contain water, stability and preservation become huge problems. Bacteria absolutely love water, so preservatives are a must. Transport is another nightmare. Sochoegar kanchki bottle tuche transport mein. There's a high possibility of container breakage. And because of the heavy glass or specialized plastic bottles and the complex manufacturing, liquid forms are generally much costlier than solid ones.
Moving on to Section 6, semi-solid dosage forms, the topical heroes.
Finally, let's look at semi-solid forms. These sit right smack in the middle between the dry stability of solids and the fast flow of liquids. Think of your everyday household topical heroes, muscle rubs like Move or Volini, or an antiseptic cream. Agar chot lagi hai, you don't necessarily want a pill traveling all the way through your stomach and bloodstream just to reach a scratch on your arm. Instead, you apply a semi-solid ointment or cream directly to the skin for fast, site-specific action exactly where you need it.
Scientifically, this offers some incredible advantages. When you apply something topically or use a semi-solid suppository, you avoid first-pass hepatic metabolism. That means the drug doesn't get broken down by the liver before doing its job. This is perfect for patients who cannot swallow medicine, highly convenient for unconscious patients, for sure. Because the drug acts locally, it drastically reduces the probability of systemic side effects across the rest of the body. And hey, if a drug is so incredibly bitter that absolutely no amount of sugar can mask it, putting it in a topical cream completely bypasses the taste buds. Problem solved.
But we have to look at the complete picture here. Semi-solids definitely have their own unique drawbacks. They can be greasy and stain your clothing pretty heavily. Tubes and jars can be bulky and sometimes a bit inconvenient to handle. More importantly,
उंगली से लगाने पर contamination का risk होता है. Every time a patient dips their finger into a jar of cream, they risk introducing bacteria. Plus, their physiochemical stability is generally lower than solid forms. And perhaps the biggest medical drawback, exact dosage accuracy is basically impossible to measure. You just can't guarantee you're applying exactly 2 milligrams of active drug when you're freely squeezing cream onto your skin.
and that brings us to the edge of what we currently know. We've journeyed from raw, bitter API powders, understood the excipients that bind them, and traveled through the reliable solids, the fast-acting liquids, and the targeted semi-solids. But the field of pharmaceutics, it literally never stops innovating. So I'll leave you with this final thought to ponder before our next session. As drug delivery technology rapidly evolves, what radical new dosage forms will scientists invent next? In our next chapter, we're going to start answering that by exploring novel drug delivery systems, or NDDs. Until then, keep questioning, keep learning, and thank you so much for joining me on this explainer.